causes of infertility in the female is multifaceted, starting from allergic reactions in the vagina to inappropriate central nervous system stimulation of the ovaries. Activities within the fallopian tubes could block movement of the spermatozoa or fertilized egg. Fertilized egg finally lands on the surface of the uterus. It will have many possible obstacles to even come on the surface. One should not forget numerous other psychological factors that have been shown to cause female fertility.
First and foremost, in the female, what we're looking for is whether the female is producing any egg. That is the woman ovulating. Then we talk about things like the fallopian tube. Is the fallopian tube accessible? Is it viable? Is it open? Are the cilia still active? Have they not been destroyed? Then we want to look at the uterus. Is the surface of the uterus good enough for implantation by a fertilized egg? And we want to say sometimes the eggs get there, they fall onto the surface of the uterus. The surface of the uterus is not good, but unfortunately, the fertilized egg does not grow to form the blastocyst. The blastocyte does not continue its development to form the embryo. This is the pattern. Now, the question is, what can cause infertility in a woman? First and foremost, the secretion within the woman's vagina may contain anti-sperm antibodies. In such cases, any spermatozoa which is released into the vagina immediately has the tail paralyzed, making the sperm so discharged not able to swim into the through the cervical canal into the uterus and further down to be able to fertilize the egg. And the next point we want to pick on is the quality of the stimulating hormones, the FSH and the SH, which are produced in the pituitary gland. These are the substances which trigger ovulation and the production of very essential hormones in the ovary of the woman. Apart from that, the malfunctioning of the pituitary gland in the woman can lead to overproduction of prolactin by them. And when this happens, ovulation, or let me say in short, the ovary in the woman is also suppressed by the effect of the prolactin in these women. Of course, we also have problems within the ovary itself, primarily in the ovaries. When ovulation does not occur, eggs are not produced, the estrogen and progesterone production is below normal, and therefore pregnancy cannot be guaranteed. The fallopian tube can get some infection, it can be blocked, the cilia could be paralyzed, and therefore the woman could get pregnant, but the fertilized egg may not be able to pass through the fallopian tube to end up in the uterus, stays there in the fallopian tube to grow and to cause what we call ectopic pregnancy, which is quite fatal. Well, thank God for the ultrasound scanning machine which can detect such a situation, and by giving some injections rather than operation, something like methotrexate, and this pregnancy could be terminated before it could go ahead to rupture the very tiny fallopian tube. And of course, we talk about the uterus. The uterus may have so many other problems. It may have some it may have some fibroids which will disturb the further growth of the developing embryo, so that it could stifle the growth of this embryo and make it impossible for it to further grow. I think I've mentioned in the previous cases of scars that are formed in the uterus, and unfortunately this one will not even permit the fertilized egg to settle down to grow.
It is obvious that a successful treatment of infertility demands a thorough investigation of its causes and then elimination of these problems by a competent expert. The modern infertility expert is well equipped to intimate nature in his center. However, there remains quite a handful of other things like lifestyle management, especially in the field of diet, that require strict attention. Reduction of 21st century stress to maintain psychosocial stability must also be considered. Many centers now advocate inclusion of herbal antioxidants in their array of medications used to enhance the process of ovulation, fertilization, and implantation. Infertility clinics investigate the clients in almost all aspects of the anatomy and physiology of the reproductive system. One should be ready to answer questions about age, frequency, and quality of coitus sex. Tests will include seminal fluid analysis, ovulation, HIV and diabetes mellitus screening, and practically everything concerning the female's reproductive system, plus X-rays and USS of the reproductive system.
Once you step into an infertility clinic, the doctor will generally be unusually friendly, because this topic we're talking about is a very, very sensitive topic. So the doctor will be unusually very friendly, but he's going to ask you very, very sensitive questions. Don't be irritated. Be relaxed and make sure that you answer the questions. He's going to ask you about your age to assess the quality of the things you have there for reproduction, and he's going to do some pregnancy tests to start with, and he's going to ask you whether you have been pregnant before if you have been a woman, or whether you have impregnated a woman before if you have been a man, and he's going to make some inquiries to find out how often the frequency of coitus, that is sexual intercourse, has been, and how well that you perform. Apart from that, as far as the man is concerned, he's going to run tests called the SFA, the seminal fluid analysis, with the culture and sensitivity. He's definitely going to do the HIV test, and he's definitely going to do the blood sugar test. For the woman, he's going to give you, investigate your menstruation chart. He's going to examine you thoroughly. He's going to examine you externally and internally. He's going to send you for a pelvic ultrasound scan. He's going to do the microscopic culture and sensitivity of your high vaginal swab. And he's going to do what we call the HCG. It's an X-ray test to determine the viability of the uterus and the fallopian tube. And of course, he's going to confirm whether you have regular ovulation or not. These are mainly what you expect him to do during a visit to the infertility clinic. Nowadays, we have discovered, and if you come to me, I will explain to you. We have discovered that by combination of powerful antioxidants like Jobelyn alongside a herbal antibiotic called Benabiotic, it has been possible to open up the fallopian tube in at least over 30% of cases. This is a great result, considering the fact that once the fallopian tube is blocked, the only alternative is the IVF method, which costs a foot and an arm. And so we are trying to encourage people who have undergone all possible means. I will recommend that they went through all the possible ways offered to them by the orthodox medical practice. And when this has been exhausted, to please try and use Jobelyn and Benabiotic. I have used it when others have failed, and I've had over 30%, let me say 30 to 45% success rate. And I think this is great. So great compared to the over 1 million naira that one has to spend on IVFs.